Good evening, everyone. My name is Lee, and I am a Vice President of MCure. We will now start today's webinar. Thank you very much for attending MCure's International Webinar 2024 today. We sincerely appreciate your coming after your practice all day. We invite Dr. Sung Cho, founder and owner of Parkview Chain Clinics in Korea tonight. Before his lecture, I would like to inform you how to use simultaneous interpretation. If you are attending with your PC or tablet, please click the interpretation icon at the bottom of the screen and select your preferred language. If you are attending from a mobile phone, please click on Language Interpretation from the other menu and select your preferred language. If the original audio is so loud that you cannot hear the simultaneous interpretation, or if you want to hear only the interpretation, click the interpretation icon again and select Mute Original Audio. Please note that the simultaneous interpretation function does not exist in older versions of the Zoom app. There will be time for Q&A after the lecture. If you have any question, please type them in the Q&A box at the bottom of the screen and send it to us. Questions can also be submitted during the lecture. Now, let me introduce the speaker, Dr. Sung Cho. Dr. Cho graduated from Hanyang Medical University in Korea. He obtained his specialist certification at Korea University Hospital and serves as a visiting assistant professor there. He is the founder of Parkview Clinic, a well-known chain clinic in Korea, and the chief director of Unjeong Park Clinic. His chain clinics are very popular in the aesthetic dermatology field in Korea. He specializes mainly in anti-aging treatment, such as scar and wrinkle treatment, and has gained the trust of many patients. In addition to being a KOL of today's machine CO2 micro-subcision injector, he also serves as a global KOL for Lijuran and Cynosure. He will talk about his extensive experience in CO2 micro-subcision, especially in the treatment of rejuvenation, scarring, and deep wrinkles, including the tips and clinical results. Now, Dr. Cho, please start your presentation.
Okay. Hello, everybody. I'm glad to be back talking to you guys about Trifill Pro, Trifill, and I hope that today's lecture will help you with your clinic and help you have better effects in the future. Okay, I would like to start my lecture now. Is that okay? Yeah. Okay. Okay. So the main topic here, we're going to talk about micro-subcision and how we use it in aesthetic medicine. So what is micro-subcision? Well, it deals with carboxytherapy, which has been around for a long time. It was invented in France in 1932 So it's transcutaneous or subcutaneous administration of carbon dioxide, CO2. So it's correction of tissue hypoxia due to the Bohr effect, we'll explain later, and it improves tissue perfusion, stimulates fibroblast activity, and lipolysis. So in Korea, before this machine, many clinics in Korea use it for stretch marks, also for fat lipolysis treatment in the fat pass. So we still use it today also, but now more and more clinics are using the Trifill Pro Trifill for the scar treatment and rejuvenation. So I'm going to be talking about today, my subject today with the lecture is, what is a CO2 substitution injector? What devices we use specifically with Trifill Pro and also other devices, in application with other devices and products. And I'm going to show you some before and after photos of my patients that I use, how I use the product, and how I use the machine. Okay. So what is a CO2 substitution injector? Well, it's a machine that also subsides the skin. So you can use a lot of gas or little gas, depending what you want to do. You can use 30 gauge needle, 27 gauge needle, 25 gauge needle to inject into the target area of what you want to do with either a product or with no product. So what is the good effects of CO2 gas? Well, it causes subcision, which is dissection of adherent skin tissue. Before we went to subcision, we always used a Norcor needle or another cannula or other blunt needles in order to create a space between the skin and the subcutaneous tissue to treat scarring. So it also creates a space for solution injection. This is very important because there are many solutions in Korea as well as other countries, such as PDLLA, which is if you inject in the skin, and if it is not injected in the right area, it can cause lumpiness, granuloma, and other side effects. So this is a very important effect of the CO2 gas, which allows for the safe injection of materials such as PDLLA and PN. So it also disperses the solution in the area that we want to use, and also the Bohr effect. So what is a Bohr effect? This is just, Bohr effect just deals with percentage of HB, O2 saturation, and oxygen pressure. So it improves enhanced blood flow, which it causes skin tone improvement and also collagen production by stimulating growth factors, and maximizing solution uptake by activating the intracellular target area. So what this does is, the effect of the Bohr effect is that the oxygen carriers increase as you inject the CO2 into the skin. Okay, what are the indications of CO2 subcision that we use with this machine? In my clinic, the best and the most popular indication that I use is for acne scar and large pores. And I also use it for the wrinkles, whether it's fine or deep, and also for the stretch marks with cellulite and localized fat deposits, and of course, rejuvenation. So the main point of the CO2 substitution indications deals with safe and effective product placement. So this device allows you to subside the skin, create an area where the product can be injected and also absorbed safely with no side effects. This is a very important point. Okay, let me talk about this device specifically, how you use it. Okay, so CO2 gas comes out of this needle with the solution. You can choose anywhere between a 30 gauge, 27, 25 gauge needle, and you can also choose how much product you want to put into the skin, also with how much pressure of the CO2 gas that you want to use. So before, we use a needle, cannula, other mechanical devices to inject into the skin or also subside the skin. But now we can use the CO2 gas pressure to get the product inside the skin, as well as cause the release of fibrotic tissue, which helps in healing and scar tissue improvement. So as I said before, there's a creation of space for the product. The gas, CO2 gas, will come in, as you see on the left of the lecture. Then we make a hole for the injection to be into the skin. And the skin, after the injection comes in, one more time, there's gas, one more time comes in, which means that the gas will be safely injected to the skin without any leakage into other areas and without leakage into the superficial area. If injection such as PDLLA is injected too superficial to the skin, you will have problems such as lumpiness and granuloma, which is very important. To summarize again, this machine is good in that it allows for the solution not to be injected too superficially, but into the target desired area. Not only with the PDLA, but also the dermal filler, HA, etc. There's so many products you can inject safely into the skin, minimizing side effects. So the solution is dispersed into the skin. So there's a decreased likelihood of nodules, lumpiness. And the other important thing is that if we do any injection with a manual hand, of course you can get it to the exact amount you want, 0.1 cc, 0.5 cc. But with this machine, you'll be more precise and have uniform and wide solution dispersion. So everything will be like a machine, very equal, very unilateral, and no lumpiness. Now I'm going to be talking about CO2 gas substitution and manual substitution with this video. So let's take a look at the video. As you can see, the thing on the picture on the left with CO2 gas substitution, you can see the gas going in uniformly, very dispersing unilaterally. And on the right, you can see that he's having trouble with the manual subcision. It's hard for the needle to go in the target area, and the gas is not dispersed equilaterally. So again, with this type of machine, the gas will be dispersed equally in the target tissue, which is very important to minimize side effects. As you can see on the right, the manual injection is still having problems. So this is a very good product in that there's better subcision, better product placement with less side effects, which is very important. So as you can see, after the video is done, with the machine, it's faster. You get better subcision, more unilateral product placement. On the right, with the manual subcision, it takes longer. It's not equally dispersed. It could cause more side effects such as hematoma and bleeding. Okay, so manual subcision. What is manual subcision? Before there's a product like this machine, we had no choice but to either use a Norcor needle, which is a 18 gauge long, thick needle. But what this does is you back and forth, go back and forth. You release the dermis fibrotic changes that occurs during a contracture when there's a scar. So when there's a scar, you go back and forth, you release the fibrotic brands in the tissue. This can achieve what you want, but there's also side effects that come with this, such as hematoma, increased pain, bleeding, and PIH. So this you can see a Norcor 18 gauge needle. I have used this in the past when I first started aesthetic medicine dermatology, maybe 20 years ago. But I noticed with the Norcor needle, it has good effects, but there's long downtime with the patient. The patient comes back with bleeding and bruising and a lot of pain. So more and more doctors are inclined not to use this needle. So in clinical settings, when they don't have this type of machine, a lot of doctors use 23 gauge, 27 gauge to dissect the skin to release the fibrotic tissue. So the disadvantage of needle subcision are, as I told you, hematoma, PIH, bleeding, pain, and if you go with like a Norcor needle with a high gauge 18 gauge needle, you can also have nerve damage. So if you do not have the machine, you have no choice but to use needle subcision, but I would recommend using not such a big needle, maybe 23 gauge, at the most 20 gauge, and make sure that you use tumescent to reduce the bleeding and PIH and hematoma. So just as a chart, we can see the difference between manual and gas subcision. Of course, if you can afford to use a gas subcision like a Trifill, it'll be much better because it's easy, more simple, saves time, more precise, less side effects. So, and also you get the additional Bohr effect of the CO2 gas, which increases blood flow to the area, which allows for collagen production. So if you just look at it with not thinking about the cost of the machine, there's no choice but to go with the gas subcision because it'll help you with the patient satisfaction and end results and less side effects. Okay, now we're going to talk about the 3-step injection versus the normal injection. Okay, the auto injection, you go vertical on top of the skin, is easy and quick with suction applied. So there's no way to go wrong with this injection method. So you put the machine perpendicular to the skin. Make sure it's always perpendicular so there's no product loss. So you could go into the skin and there's a suction. And after the suction is made onto the skin, the product is placed inside the skin before with CO2 gas subcision. Then the product is injected and then one more CO2 gas is injected into the skin to create a safe bubble where the material is injected safely into the skin with no side effects. And this machine is very easy to operate freely. It offers a wide range of applications. You can move the needle up and down on the handle, very easy to use. The connector is really easy to connect to the machine and it's relatively easy to use, so it's really user-friendly and you could set it up in 20 seconds, very easy. So you also have an alpha pen injection. This is just for a simple CO2 gas injection when you don't need to inject materials or you don't need to use any product or you just want to just use simple CO2 gas injection. So when do I use this? I use this actually before I use the main manual injector. Why do I use this? Sometimes I want to use the alpha pen before to subcise the skin for a better effect. For example, if a patient has a large area of stretch marks, I will use a simple CO2 gas injection into the area. Then I will use this machine again to allow for better subcision and better product placement. And also, you can also use CO2 gas injection for simple patients. For example, you have a patient who wants improvement in fine wrinkles under the eyes. So you can use this maybe once a week or once every 2 weeks to improve fine wrinkles. You can also use this, for example, for patients who want to lose some fat in this area under the chin, or they want to have rejuvenation. So you can inject with 30 gauge needle on the V-line area, on the mandible. So this has very many applications to use alpha pen. It's relatively pain-free, simple to use, and I like to use it as adjuvant therapy when I do rejuvenation procedures with other products and machines. Okay, so when you inject into the skin, the first step is gas will come in, then the needle will come in. After the needle comes in, the CO2 gas comes out, and after the product is placed in, another CO2 gas comes out. So the solution is injected into the skin safely below the epidermis, which reduces, again, the dangers of lumpiness and granuloma, which is a very big concern in dermatology and aesthetic medicine. So this shows you an illustration one more time, just to repeat myself. The CO2 gas will come into the skin, the solution will come in, and then one more time the gas will come in to enclose the product within the bubble like a balloon. And the good part about this thing is that it is unilaterally injected. Every molecule size is the same. So you have constant results that are objective and not subjective. Okay, there are so many literatures out there. This is a German journal that was published in 2008. It shows you that the patient's skin can be improved with CO2 therapy. Also, I like to use CO2 therapy if you have keloid patients in your clinic. As you know, we are Asians, so Asians tend to have keloid lesions, whether it's from acne or other procedures or just from trauma. So what I like to do is like to use a CO2 alpha handpiece and subcise the skin and then use steroid injection. This will really help improve the keloid scars. I'd really like to recommend this to you, to the doctors out there in Japan who use machines and other devices for keloid lesions. I recommend this concept highly. And also, there's another subcision approach with the CO2 fractional or crossing HA versus subcision alone in atrophic post-acne scar patients. So the first patient was used with just CO2 fractional laser with subcision. Second group, HA and subcision. And the third group with subcision only. So this is an article published in 2022 in the Middle East about the effect of subcision in conjunctival therapy. So you can see the results of the patient. This is from the Middle East. Grade 4, you can see atrophic acne scars before laser treatment and after laser treatment. And on the D, you can see HA fillers 6 months after the treatment here. So you'll see very noticeable results if you use subcision in combination with HA or other products. In Korea, we do use HA, but I prefer to use PDLA or PN, polynucleotide. The reason I don't like to use HA is a little bit more, as you can say, transient or something that does short acting. So if you have an important event, I would recommend using HA. But if you don't have an important event, I would recommend using, again, polynucleotide or PDLA in connection in conjunctivity with the HA. With the Trifill subcision method and fractional laser. Again, this is another journal which is using the effectiveness of subcision plus CO2 fractional laser in the treatment of acne scars. In summary, it just shows you that CO2 therapy with lasers has a good effect and improved efficacy in patients. And also, this is another therapy using CO2 in which it says that CO2 application helps in chronic wounds because the CO2 increases blood flow to the area, which it allows for collagen production and a faster result in healing. So there's so many these journals out there that shows you the effects of CO2 injection. This helps with collagen production. In essence, in summary, all these journals point to the fact that CO2 in conjunctive therapy with laser devices or other products increases the chance of good results with zero side effects. I haven't seen one case of carboxy that caused any side effects except for bruising and pain. Again, all these journals and all these papers support the fact that CO2 is very safe and there's no problems using it in patients. Again, I like to emphasize that these journals show that CO2 in conjunction with other laser devices and products will create a good program to increase the scar treatment along with pore reduction and rejuvenation. So this is the heart of the lecture. This is really what I want to talk about from my clinical experience using this machine, along with, I have so many other laser devices I have at the clinic, how I use it together to treat acne scar, large pores, deep wrinkles, rejuvenation, and stretch marks. I believe that these four are the key components that you should use with this laser, with this medical device. With this medical device, you also have to use which product you're going to use. Again, there's PDRN, PN, PLLA, PDLLA, PCL, calcium hydroxyapatite, and also dermal filler. In my clinical experience, I prefer to use PDLLA and PN. These other ones, such as PCL and calcium hydroxyapatite, which is also known as Radius, I don't like to use these products because they can cause granuloma, and just to use them for the skin, it's not economically feasible to use these type of products. Again, PN, PDLLA, and PRP and dermal fillers. Those are the four products that I like to use with this product, with this machine. So the energy devices I like to use, just to show you in conjunction with this machine, I like to use the 532, 755, 104 nanometers. You can either use Q-switch, long pulse, or Pico. In terms of scar treatment and pore reduction, of course, I like to use a Pico fractional laser, 1064 wavelength. I also like to use the RF radio frequency needles uh, versus non-needles. So I like to use RF needle machines, which helps with reducing of scars. And of course, you can use this in conjunction with rejuvenation of HIFU or a plasma or CO2 fractional lasers. It's up to you. There's so many lasers out there you can combine with. I will just, in the future, I will just show you what combinations I like to use in this lecture. Okay, so we talk about scarring, which I think I told you about is the main advantage of this machine. When you talk about scar treatment, of course, you're going to have to use energy devices, products, etc. So there's 4 type of fractional machines that you can use. The Ultra Pro CO2, the Erbium or the 1540 wavelength erbium, or also the fractional repair, fractional CO2, and also, it's not here, but needle RF, and the pico fractional laser. So there's 6 actually that you can use. The reason that I not use Ultra Pro CO2, which is very effective in treatment of scars, because in Asian skin, if you use a high fractional CO2 laser, it'll cause PIH and prolonged redness. You will treat the scar, but you also cause other problems. So I do not use this too much. I like to use the Erbium because it helps with the scars. But if you use this laser too much, again, it will also cause prolonged redness of the skin. So all the doctors out there who use the Ultra Pulse CO2 or the Erbium, you know what I'm talking about. Because if you do too many treatments, the patient will start developing sensitive skin, itchiness, sensitivity. So again, you have to be careful when you use these lasers that actually are coagulate the skin, causing damage to the skin too much. So again, that's why I like to use the Pico fractional 1064, Pico 755 needle RF lasers in combination with the CO2 subcision and the product, which I think have wonderful results. Okay, so we talk about scar treatment. As I said before, this machine works wonders with keloid scars. There are so many keloid scars across Asia as well as other countries. The best treatment to use is using the alpha pen. After you subcise the skin, you inject a steroid triamcinolone injection, which will reduce the amount of steroid you have to use and have better results faster. So in any clinic setting you have, if you have keloid scars, acne scars, hypertrophic scars, this machine is a must because it really helps reduce the side effects of steroid injections. Sometimes if you inject steroid injection with too much steroid, it'll cause atrophic skin, widening of the skin, there and making the skin thinner. So you don't want any of those problems because once you get those problems, it doesn't come back. So again, I really recommend using this machine for these type of scars with a reduction in the steroid dosage that you want to use. Now the main atrophic scars that we're all worried about. We have the ice pick scars, which are deep and narrow. They're sharply demarcated that extends to deep dermis. These are very noticeable, and there's usually from people who usually squeeze their skin when they're younger from acne. There's also boxcar scars, which are shallow or deep, depending on which type it is. They're flat-bottomed. And also, a lot of Asians, we have rolling scars, which are generally deep. They're causing dermal tethering, and they're sloping like this. So again, how do we treat these scars? Okay, so in these type of scars, we have to, of course, cause damage to the skin, whether it's a fractional or a coagulative laser. It depends on what you want to use. So in my clinic, I like to use these type of lasers, a needle RF. Also, I like to use the Pico 1064 laser with high energy, which will cause the collagen production in the scar areas, which causes the deviation, depressed areas to come back up. In conjunction with the subcision machine that I use, this black machine, when I use this machine, I place the product, whether it's a PN or a PDLA product inside the skin, and I finish it with a sono to calm the skin after these invasive procedures will cause redness and swelling. So again, this is the most popular program that I use in my clinic. I do everything on the same day, and I think it works wonders for the skin. So with these type of needle RFs, I like to use them because you can pick so many different type of needles that produce energy at the tip or also with the tip and middle of the tip. So there's so many good machines out there. So I'm sure you have them in Japan. If you use a really good needle RF, it'll really help help with collagen production and scar reduction. Just to show you that the product, when it goes into the skin, the depth of the needle contradicts, which indicates which area of the needle the product will go in. As you know, if the needle is more invasive, the product will go inside the skin more. So with this type of machine, you can get the product into the skin in a deeper area more safely compared to these type of other injectors. Okay, so to get to the main focus of the machine, there's all these type of machines out there, but the machine that I want to tell you about today, this machine is very easy to use, very user-friendly. After 1 day training, you'll know how to use it. Okay, so what you do, you see on the left, the CO2 spray, you can use anywhere between 0.1 all the way up to 1. And you get the solution 0.1 all the way up to whatever you want to use. So the main thing here is to know that there's a CO2 amount, a solution amount, and also you have to indicate which gauge needle you're going to use, 30, 27, 25. And also right here, the gas is like a battery. It shows you how much gas you have. Usually you should have gas. It should last for a long time, so you don't have to worry. Once you get used to this machine, I like to press auto so it comes out uniformly, so you don't have to keep pressing the foot pad. So for PDLLA, I like to use a solution of 0.2 to 0.4 cc. I like to spray 0.2 to 0.5. For the PN solution, I like to use 0.5 to 0.1. I like to spray it from 0.2 to 0.04, or 0.2 to 0.4. And for dermal solution, this is typed wrong. I like to use solution 0.03 to 0.08, spray 0.2 to 0.4. So in general, I just use the spray from 0.2 to 0.5 when I use this type of machines. Okay, so there's some tips when I use the procedures. When you do scar treatments, such as ice pick scars or rolling scars, especially ice pick scars, if you have ice pick scars, I would highly recommend using a dot peel, TCA peel, which causes frosting on the skin. So I like to use anywhere between 50 to 70%. I know in America or some other countries, they use 100% TCA. The reason I don't recommend TCA 100% is it causes PIH in Asian skin. So if you're using this type of peel first time, I'd recommend 50 to 70%. In my clinic, I use 70%. And I recommend using more CO2 gas with a higher dose of PDLLA. With a higher dose of PDLLA, the molecules become bigger, so you need more gas to push inside the skin so it does not have contact with the epidermis. And also, once you become comfortable with this machine, yes, I do combine PDLLA and PN injection into the skin. I have not had one case of allergic reaction. In order to get a better combination, I like to use this combination as well. So also, I like to use higher energy with lasers for the more severe cases of acne scars and deep wrinkles. So in terms of deep wrinkles, in my clinic, the number one indication for deep wrinkles with this machine is neck wrinkles and forehead wrinkles. That's my number one reason they come to see my clinic. So if you think about it, when we have deep wrinkles or we have wrinkles on the neck, what can we use? Dermal fillers, PDO thread, that's it. There's actually nothing else. Of course, you can use HIFUs or needle RF, but I feel those results are not as effective as dermal fillers or PDO thread with subcision. When we do PDO threads, before I bought this machine, of course, I used a manual cannula to subcise the skin. And then I injected filler with PDO thread. But with this machine now, I can use subcision on the skin without using cannula, which causes bleeding, swelling, hematoma, PIH. This machine is so good because it can cause a subcision on the neck and also places the product into the skin uniformly with more accuracy. So again, I save time, less side effects, finish the procedure faster with better side effects. But with a patient with grades 3 or 4 with the neck, you have to warn the patient that you have to have at least 10 treatments. With grade 1, 2, 5 treatments will be good enough to see good results. With grade 3 and 4, again, you need to have at least 10 treatments. Also with the forehead, when you have severe grade 4 or grade 5 deep wrinkles, you need to, again, have at least 5 to 10 treatments along with the product and also subcision. And also you can see right here, the marionette line area, there's really nothing you can do in this area except dermal filler. Of course, you can use RF like the Thermage, or you can use other needle RFs or other monopolar, bipolar RFs to help with the wrinkles. But I feel you can use those machines with subcision and also CO2 gas, which causes synergy effect, which is so good results. In my opinion, I like to use subcision with CO2, and also I like to use a product placement of PDLLA in conjunction with threads. That's my number one area to treat, this area here. Okay, so again, with the deep wrinkles, again, the solution is very similar to the scarring. This is the way I like to do with the PDLLA, PN dermal filler. In general, it's the same, except that when I use dermal fillers, I like to use a solution a little bit more, like 0.08 up until, depending on the depth of the dermal filler. Sometimes I use 0.1 also, depending on how deep it is, how thick the skin is. So again, in general, this is your protocol. But again, once you get more comfortable with the machine, I will of course use more solution and a higher spray dosage. So in terms of the neck treatment, this is the way I would like to use. I would like to use the PDO thread, depending on, if it's cocked, if it's a mesh, or if it's twisted like this. So it depends on what you like. So I like to use the PDO thread along with Botox, along with the CO2 fraction of CO2 subcision and the product placement of PDLLA. Okay. So now I want to talk about rejuvenation. In terms of rejuvenation, we can have so many different energy devices out there. We use, of course, a picofractional laser for rejuvenation. We use injections of PN, PDLLA for injections. But if you already have this machine, it helps to also rejuvenation, because the CO2 gas itself, due to the Bohr effect, will cause increased blood flow to the area, which will increase collagen production and increase the skin to become more whiter. And also, this is very important. If you use this machine to inject the filler or any other product, it'll reduce the side effects caused by necrosis or lumpiness, granuloma, because it'll inject this product into skin safely with less pain. So again, in terms of rejuvenation, I reduce the solution dose because you have to do full face. So I lose the solution 0.1 to 0.2. And I also reduce the spray because you're doing the whole face. And always remember, when you do around the eyes, to use a thumb to make sure that the gas does not go towards the eye, because the patient could feel discomfort when you do injections. And be careful under the eyes, because under the eyes you could have bruising and some pain. And make sure that your thumbs go under the eyes to make sure the gas does not come up here to cause some kind of discomfort. So when we do rejuvenation, I mix the product with Botox. For full face Botox, I use 30 to 40 units. And I safely increase dosage of PDLLA along with the production of CO2 gas. This helps because it treats scar areas simultaneously also. So if you use rejuvenation with this type of mixture, it can also help treat scars along with rejuvenation, hydration, and increase in whiteness of the skin. Okay, now let's talk about stretch marks. This is a very important indication. As you know, stretch marks is very hard to treat, especially with Asian patients, because if you use high energy machines like plasma devices, it'll help. There's many famous plasma devices that helps with reduction of the stretch marks, but the main problem is PIH. Because once you get the reduction of stretch marks, the high energy causes the PIH because it's far from the heart. So there's two different types of PIH, stretch marks. There's stria rubrae and stria albae. So stria rubrae is a little bit more easier to treat. Stria albae, I think, is a little bit more difficult. So stria rubrae is a predominance of fine dermal elastic fibers with evidence of structural changes in collagen. There's an increase in mass of microvascular blood flow, which contributes to their red color. And the stria albae is epidermal atrophy with loss of ridges. So they're all densely packed fibers parallel to the dermal epidermal junction. Okay, so to treat this is very, very hard. But in my opinion, if you have at least 10 treatments, you can reduce it 30 to 40%. So with the stretch marks, this is the way I like to use a solution. I think you have to use more spray because the dense fibrotic tissue that's in the stretch marks, you have to release them. So I like to use a spray from 0.3 to 0.8. I also like to use a solution from 0.2 to 0.5 with the PDLLA. With the PN, I like to use a higher dose, 0.05 to 0.1. And with the dermal filler, I like to use 0.3 to 0.8 spray with a solution of 0.03 to 0.05. This is my standard I like to use in clinic when my doctors use. But if this patient is more severe, of course, I will use more spray and I'll use more solution depending on the severity of the patient. So tips with stretch marks. I like to use a KTP laser 532 rubrae lesions, pieces red. And I like to use a 755 or 1064 fractional laser. I do like to use a CO2 fractional laser or plasma devices because it causes higher incidence of PIH. I like to use it in conjunction with monothread, and I maintain the treatment with retinol cream 0.025% or 0.01%, depending on the sensitivity of the skin of the patient. Okay, now I want to talk to you guys about some clinical photos. Okay, this is to show you there's a scar. Okay, I don't know if you can see it, but the patient came to my clinic because she had a scar 1 year ago. She fell down. She had this site sutured. You can see it on the left. So what I did was I used this machine. I used the alpha pen 2 times before. Right after I did the alpha pen, I injected the PN, which is Regeron S, into the skin with I believe, with a dosage of 0.3 and with the CO2 gas of 0.3 also. So after 3 treatments, you can see improvement in the scar right here. This is another patient with 3 sessions with the machine and also with PDLLA and filler. As you can see, there's linear injections you can see after the treatment. And after 9 weeks, you can see a drastic improvement in the deep wrinkles of the skin. So depending on how many treatments you have, it depends anywhere between 3 and 5, you can expect good results. This is another patient we used for neck wrinkles after 1 section with PLLA, and you could also see improvement in the neck wrinkles. This is one of my workers. I use alpha pen. This is stria alba. And also after I do that, for the injection into the skin, after 3 sessions, this patient had good results. This is one of my other staff. After 2 sessions, of course, there's some bruising. I use this machine along with PDLLA with PDO thread and Botox. This is another patient I used with a CO2 gas solution and PDLLA, which shows increased reduction in pores and then better rejuvenation of the face. with hydration and also better complexion. As you know, the eyelid, if you do not block it, it'll go into the eyelid, causing some discomfort. So I like to use my left thumb to make sure the gas does not go near the eyes. This is just to show you that I use this machine also for the stretch marks in the abdomen area. So I like to use this treatment every 3 to 4 weeks, at least 5 treatments, and you see good results. Except for the Straya alba, there's no improvement in the color discoloration of the white lesions, but in Straya rubrae, with the KTP laser, you can see improvement in the red lesions. So that's the only difference. This is another patient I have, which had severe acne. So I used a KTP laser to reduce the redness, and also a picofractional laser for the scars, along with TCA peel and this machine injecting with PN and PDLLA mixture. Just to show you, this is a patient with a Zuster chickenpox scar. So what we did, we used a dot peel, 70% subcision and Regeron S to have this end result after 3 sessions. This to show you, if you do not use these type of machines and you inject manually too much product into the skin, this is caused by PDLLA lumpiness. So once this happens, it's hard to get rid of. If this happens to one of your patients, the only option you have is to surgically incise him, or also steroid injection, or using O-therapy or HIFU to break down the product itself. So this is a very big problem. So that's why I love to use the CO2 subcision machine. It's very safe, and you can reduce the cause of these type of things almost to 0%. And also, if you use PDLLA without you use it with manual injection, you can develop these type of granulomas. So this patient, you could actually feel the granuloma on the skin. Again, to get rid of this, you have to use a steroid injection or a surgical incision. So again, this machine is very good, not because it helps only with scar reduction, deep wrinkles, stretch marks, rejuvenation. It also reduces the increase of side effects, such as granuloma and lumpiness. So again, this kills 2 birds with 1 stone. That's why I really recommend these type of machines. So, so the PLA microparticles and PDLA microspheres, it's a little bit different. So the mechanism is similar, but you have to know that everything has to be precise. The weight of the machine, the weight of the product, the shape of the product, in order to get less side effects. So again, I like to emphasize that this machine injects the particles unilaterally into the skin with every microsphere the same. So it's very good in that it's a machine, in that it injects into the skin very equally, so you have less chance of lumpiness or granuloma or any side effects. So again, this is a very important picture to remember, because this machine does kill 2 birds with 1 stone. It treats the patient and reduces side effects along with pain reduction. So in summary, I'd like to say that before you use PDLLA, you have to mix 24 hours before use to decrease these type of side effects. You use in combination with energy devices, and you use more CO2 spray in difficult cases, along with more product. So there's a synergy effect and wrinkle and rejuvenation. So again, the CO2 dissection is good in so many different areas, but again, in my clinic, for scar reduction, deep wrinkles, stretch marks, and also rejuvenation. Those are the main areas I like to use them for. Okay. Thank you for your time. I know it's late right now, but I will love to answer any questions you have about this machine. Thank you for listening to the lecture.
Thank you for Thank you very much for your valuable presentation. We have received some questions for Dr. Joe, so we would like to move on the Q&A session. If you have any questions, please enter them in the Q&A box at the bottom of the screen. So first question is, which solution do you like the best when you use Trifill Pro, Dr. Joe?
Again, I like to use the PDLLA and PN. Those two I like the best.
Okay, next question is, what are the good methods to control the pain during the procedure?
Okay, for the pain, if the patient is very sensitive to pain, I will do two type of treatments. One is I like to use lidocaine, and then I use something like a sonophoresis machine and permeate the skin with 1 megahertz for 10 minutes. Have the staff use it for 10 minutes like this. That makes the lidocaine go into the skin more effectively. And I also like to use nerve block here, 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 and here to reduce the pain if the patient is very sensitive.
Yeah, thank you for your detailed answer. So let's move on to the next question. Is it possible to cause a long middle-term space with CO2 injection?
I believe that it's very rare, it's very hard to cause any long-term effect because the CO2 gas is very short acting. It goes in, subsides the skin, it goes away like this. So it doesn't have any, it's not like a needle where you go in, manual, it stays there for a long time. So it's very short acting, very fast. So the chance of any side effects is very, almost none, zero.
Okay, thank you for your detailed answer. So next question is, what is going to happen if we inject CO2 gas inside the blood vessel?
That's a good question. Again, for example, if you put my CO2 in the needle into the vein, what's going to happen? It's going to go into the vein. And since it's short acting, due to the physiologic nature of the CO2 gas, it's going to permeate outside the vessel. It's not going to go like, not embolism. There's no chance of embolism. It is very affinitive towards the blood. So it'll permeate outside to the blood vessels, and there's no chance of embolism or any air associated side effects. It's very impossible. It cannot happen.
Thank you for your explanation. So next question. I think a strong adhesion will not be released by Trifill Pro injection because CO2 gas will go to looser space. How do you feel?
Oh, can you repeat the question?
Yeah, the question is, I think a strong adhesion tissue will not be released by Trifill Pro injection because CO2 gas will go to more soft tissue.
Oh,
So
okay, that's
how
good.
do you
Okay.
feel?
For example, if the deep forehead has a deep lesion like this, right? Then what I do is, if I use a CO2 of the machine, and I use a maybe 25 gauge or 23 gauge to inject, and it doesn't go like this, then of course there are certain cases where I have to use the manual substitution in conjecture with it one time. There are some cases, but not very many.
Okay, thank you for your answer with a specific example. The next question is, Acne has several types, typical box, ice pick, and rolling. Do you feel difference in efficacy with Trifill Pro?
Yes, there's a difference. As you know, rolling scar is very, very hard to treat with anything. So with rolling scars, sometimes you have to use triple coat dermal filler, I think, to get it up a little bit more. And with ice pick scars, I think it has a very effective, and also with the box scar, very effective.
Thank you
But
for
I
your
also like
answer.
to recommend using TCA dot pill. You have to use TCA.
Okay. Thank you for your answer. So next question is, could you tell me the details of treatment protocol and solution for neck wrinkles with Trifill Pro?
Okay, so for neck wrinkles, what I really like to use is PDLLA, injecting, depending on the depth of the wrinkle, 0.03 to 0.04. and gas 0.05 along with PDO thread and Botox. I love to use that protocol.
Thank you for your specific example. And we have received some questions through the Q&A box as well. Dr. Cho, could you please select few questions and answer them?
Yeah. Okay. Okay, I see it. Okay. Can I use Beltero Revive injection with Trifill? Yes, you can. I would prep the medication, 1 cc. So after 1 cc, I'd use 0.04 to 0.05 per injection. Okay, and also the rest one is in Japanese. Oh, how many cc's of CO2 in difficult case? I use difficult case 0.8, 0.9 for difficult case I use. Okay, depending on the size, how many treatments for acne scars are needed. For most patients, I recommend at least 5 treatments, 5 to 10 to 15, depending. So minimum is 5 treatments, 1 month apart. Okay, and also I want to talk to Karina. She said, how can you explain more about PDLA dosage for rejuvenation? Yes, PDL, you can mix it with non-cross-linked HA depending on the milligrams of the dosage of the bottle, 50 milligram, 100 milligram, depends. We mix it with HA and normal saline, and we have to make sure that you have to mix it 24 hours before, so you do not get any side effects. What needle number so you can treat acne? The needle number I recommend is 27 gauge or 30 gauge, depending on the size of the treatment. Is there other scar? Okay. Actually, there's not that many scars that Trifill cannot treat because any scar is indication for treatment. Any scar. But I would not recommend this treatment for scars on the lips, which I do not think works effectively. The lips and the eyelid. Those 2 scars I do not treat. Anything else I treat.
Okay, thank you for your thank you for your answers. And we received by Japanese, many Japanese questions. So I just gather the English translation of their Japanese question. So I will ask to their question now. Okay, so first is, I understand it may depend on the symptom, but what is the maximum area that can be treated in one session?
This is a good question. This, for example, if I use, I have another carboxy machine to treat fat. I inject 1,500 cc's or 2,000 cc, 3,000 cc for stomach or the thigh area. There is really not too much you can inject. There's not a maximum, but if you inject over 100 to 200 cc's in the face, you'll feel some discomfort on the face. But besides the face, it should be okay.
Okay, so another question is, for the Nasby glabella and the Indian line are quite difficult areas for hyaluronic acid injection.
Yes.
Is it possible to use in the such area?
Okay, for the Indian band, for the glabella, glabella is a different story. Glabella, Trifill works good here. So I like to use Regeron or PN here in the glabella. So I like to use a 27 gauge needle, not 30. 30 is not effective. 27 gauge, and you make sure that you have your thumb so it does not go into the eye area. So I like to use gas 0.05 and the Regeron 0. Or any PN 0.03 to 0.04. For the Indian band, I feel that this machine is not indicated for the Indian band. For the Indian band, you have to go deeper, very deep, almost to the bone. So that area, I'd recommend using dermal filler and PDO thread for the Indian areas. Because you have to go, again, deep dermis which is not in the area which we want to use for this machine.
Thank you for your answer. So another question, Japanese question is, it is said to be effective for hypertrophic scars and keloid resulting from acne. What is the purpose of removing the lysed area with CO2? Is
Okay.
it to calm the inflammation through the Bow effect? Is
Yeah.
there a concern that the Bow effect might actually worsen the condition by promoting collagen production?
Oh, good question. I do not think it'll worsen. The reason I like to use this CO2 for the keloid scars is, okay, well, there's so much adhesion with the keloid scar, right? If the adhesion is like this, sometimes the needle will not go in. Sometimes the needle, it's very hard for the needle to go in. So what would we use? We use cryotherapy to reduce the adhesion like this so the needle can go in. So instead of cryotherapy, because cryotherapy causes PIH of the skin, if you use too much cold cryotherapy here on the top, it causes a PIH to happen. Sometimes a burn could happen also. So with this type of machine, you just use a little bit of gas to go in like this, and it makes it pop. Then you make a space for the triamcinolone injection, which will allow for less steroid use. And also because of the Bohr effect, it'll increase, of course, increase collagen production, but not in a way that increases the hypertrophy, because a keloid lesion is not because of collagen production. In a sense, it's causes because it's autoimmune, because it causes the body to say it's to refuse trauma, to increases collagen in that area. But as you know, if you use a PN in the keloid lesion, it decreases the collagen lesion and increases the colorate. It helps with discoloration with the keloid lesion. So again, the Bohr effect is not indicative here, which will increase it causes it to cause worse. It'll help it because again, it increases the space necessary for the steroid injection.
Okay, thank you. So maybe this question is last question because due to the time schedule. So if you, as you said, you have some combination treatment of Trifill Pro with another energy device, do you use Trifill Pro with another device in the same day or more separately, more
I
with
use
the
everything
interval?
same day. Everything same day.
Uh,
Yeah.
okay.
So whether it's needle RF, picofractional, everything same day.
Thank you for your time for the presentation and Q&A time, Dr. Zhu. So we will follow up the other question after the presentation. So we will now conclude the webinar according to the schedule. We will follow up the remaining question after the seminar. So thank you very much for your time and for watching today. Thank you.
Thank you.